Friends, our today topic is seborrheic dermatitis, and today in brief we discuss why it happened, why people are suffering from seborrheic dermatitis, what are the reasons behind it. Seborrheic dermatitis is a condition which is a non-infectious skin disease significantly affecting the scalp in the initial period. Later on, it affects your face, your ears, your eyelashes, back, and 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 neck also. So, in babies, seborrheic dermatitis is known as cradle cap. Seborrheic dermatitis is common dermatitis in a problem we are facing in modern life. It covers the scalp, face, upper part of the body. Uh, so why people are suffering more in modern lifestyle? There is a main reason. What we are doing, we are using too much hair products, and we are using medicated creams, styling product, which is damaging your skin, and most of these products are containing alcohol that will flare up more these things. People are using more cosmetics, are suffering more than those which are not using it. So if you check the picture shown in on our website, in first picture there is a seborrheic dermatitis. First reason is written excess of sebum. So why there is excess of sebum? Because sebum gland, the oil producing gland, are producing extra oil. Normally people are not having producing extra oil. When they are producing extra oil, too much stress, cortisol hormone is released. Second, people are having hormonal disturbance. For example, they are youngster. Today generation youngsters are too much in stress. They are over worried. Okay, they also produce extra amount of sebum. Okay. Second reason is the why seborrheic dermatitis grow. People are having lower immunity, or immunity is getting compromised due to use of more product which are unhealthy. Modern foods are 90% are not of the food value; they are more of the palate value. They are tasty in taste, but they are not nutritious in their quality. So people are having eating long term wrong type of food, fast food, having Ajinomoto or the monosodium glutamate, that lead to your immunity get compromised. So immunity compromised people are more suffering, and which are having lower immunity. People with AIDS are also having higher chances of developing it. HLA-B27 also producing it. Lymphoma or other diseases which affected also producing it. The classical clinical feature are scaling, which is occur due to proliferation of malaria. As the second point is the proliferation of malaria, there are various factors may cause the seborrheic dermatitis, and the sebaceous gland fungal colonization is in skin surface, genetic or unhygienic environment affecting area of the head and trunk where sebaceous glands are more prominent. Once the malaria start growing, it it is a lipophilic. It eat your oils, so skin get drier day by day. If you check the picture, there is a healthy scalp. Then say later on the sebum production of the microbial action of the scalp. Secondly, the sebum is getting produced. It start growing the malaria species of yeast. Yeast start eating the oil there. The skin getting drier. Third is, if you check the picture, third one is irritated dry scalp. The once the yeast eating it it eat all the while, the skin getting dry ultimately. Then the flakes will occur. The flakes will be yellow, thick, white, or yellow greasy. Sometimes it is too much greasy that you can hardly remove your from your scalp. It is present as greasy erythematous patches on the scalp of the adolescent and as some people on the nasolabial area also. Okay, and once it is visible on face, people are mostly getting irritated. Okay, they are getting disturbed due to this. They are getting panic. Why it is happening to us? Youngsters are very panic for this problem. Okay, now we are going to pathogenesis of seborrheic dermatitis. Pathogenesis, there is two picture visible. One is a normal one, and below is a seborrheic dermatitis skin. In normal skin, the skin's barrier is intact. So, if you are washing, if you are having sweating, nothing is going inside your body in the normal above picture on the side. Okay, and the below there is a picture where the immune system get hyperactivated because the malaria uh, lead to flaking. Flaking lead to skin barrier epidermal differentiation get lost. Now, if there is any sweating occur or if there is any water going inside, you that is penetrated inside your skin layers. The immune system get hyperactivated, mast cell are produced, and immune system is getting responded. That will lead to more symptom of itching. Itching is due to mast cell reaction, which is a allergic reaction of the body to the various element. Exact causes are not easily understandable by the modern society. Even the most of the people say it is incurable. In the modern society, in the modern medicine, there is only two medicine we have. One is ketoconazole, second is fluconazole. All the medicines are failed at present to control this. Okay. Now the malaria hormone, environmental factor, people with the Parkinson disease, having palsy or the paralysis are more prone to develop seborrheic dermatitis. Now we are going into the reason behind it, the causes of seborrheic dermatitis. You can read all these detail in my website, but we cannot discuss here all the point, because if we discuss all the point, then the video get too much lengthy and you are getting bored of too much um, discussion. Okay, so there are main four causes. One, naturally occurring scalp fungus called malaria, break the sebum. Normally it occur on our scalp, doesn't hurt us, but when it produces in the higher amount, it lead to skin drying. As we discussed above, I show you in the pictures. And scalp fungus is a main cause. Second is sebum is consumed by this fungus, lead to oleic acid. Oleic acid lead to irritation when it released by a fungus. That lead to erythema. People are start stress scratching their head violently. Sometimes they are scratching so much that the blood is coming out of the area. Okay, scalp become inflamed in few cases. If you touch the scalp, people will cry due to this. Okay, so the genetic factors are also play a role. Few genetical disease or the few factors, so also X-aggregated immunocompromised patient, AIDS patient, lymphoma patient are having high risk of developing it, paralysis, Parkinson, cranial paralysis, or the other paralysis are also increasing the incidence of developing it. Now we are coming to the symptoms. What are the basic symptoms of this? Symptoms are individualistic. Few people are developing slight symptoms, few are having all symptoms. Symptom we are defining here, that doesn't mean every patient develop these symptoms. Okay, so the main symptom is abundance of dandruff, which is visible with the naked eye or with the microscopic eye. Okay, people using ketoconazole, it is visibly hard, otherwise it is visibly easily. It may be whitish, greenish or yellowish. White is almost normal, green or yellowish is infectious more. Okay, so if there is abundance of dandruff, roots are affected, sebum gland is having an infection of fungus, hair loss occur, erythema or the pruritus or the itching occur in the area, people start itching again and again. Thickening of the skin of the upper layer in the long chronic region, which is called as stratum corneum, or the oily skin occur in the face, people look more oily. eh, eh, then more dry skin start peeling, and peeling is visible to others. So parietal or the malolabial fold are more affected. Some people are having problem in their ear also, ear is having more itchy. Some having the itching in the axilla. Axilla is this part of the axilla is affected. Some people are having affected of the genital parts also. So the skin, it affects different parts of the body in advanced stages. It lead to so many areas that people life is getting disturbed. Mostly it is confused between the four diseases. People are coming with seborrheic dermatitis always confused whether they are having seborrheic dermatitis, whether or they are having psoriasis, whether they are having dandruff, or whether they are having eczema, eczemic atrophic dermatitis. Okay, so all the things are looking similar, but there is slight differentiation. A good educated doctor or the doctor having knowledge of the disease can differentiate seborrheic dermatitis from the psoriasis. For example, seborrheic dermatitis can be washed off easily, and if you wash off with the good shampoo, people are using 99% ketoconazole, it is removed and it reoccur again. While in psoriasis case, when you wash your hair, it doesn't wash out. It remains there. The skin still get thick and still that skin is there. The scales are itchy, they are dry, they are more silvery in color. Okay, while in seborrheic they are more reddish in color or whitish in color. They are not silver patches. Silver patches are more visible if you go under the sunlight. It looks silvery. Okay, so dandruff is also confused with seborrheic dermatitis. Seborrheic dermatitis cause scaly patches. Okay, dandruff although look scaly, but they are having a minor as compared to the seborrheic dermatitis. They are the thick patches. Okay, the patches are that type that if you wash your hair, the skin water goes inside. It may lead to erythema, redness of the skin, or more pain in the skin of the head. That is seborrheic dermatitis. In dandruff, it is acute condition. Seborrhea is a very chronic condition. Dandruff occur only in the head, while seborrheic dermatitis occur on the head, on the face, nasolabial area, chest, and the back of your chest, Okay. So, eczemic atrophic dermatitis. Eczemic atrophic dermatitis basically occur in the children, not in adult. So the type of seborrheic dermatitis is very confused in children from the atopic dermatitis in the adult. It occur only in children, not in adult. common in having the people with family tendency. People in the family are suffering more. Okay. Now you can read all these points in our website. In our website, we deeply write all the topics. Okay. In a topic dermatitis, it is more red or rosy in color. In the even the rosacea is the term used. Okay, in the topic dermatitis, you can read all these article and understand on your own in our website askdrmakkar.com, and you can get more thorough knowledge, because in our video we cannot define each and every part. For example, few things are difficult to discuss in the video. Okay. Now self care measure. In self care measure, you can do basic few things which can save you. First of all, wash your skin or hair regularly. You can use a curd and wash with curd once a week. Use a tea oil. It acts as a disinfectant. It is also a disinfectant, anti-inflammatory or antifungal agent, while curd is more a lubricating agent plus as a washing agent. We are using tea oil plus tea tree oil plus your using of the curd will reduce it to the extent. Rosemary is also having a very good property. If you eat rosemary leaves, it is having very good properties. If you eat garlic is also a very good uh, mm, agent. Avoid medicated cream, avoid styling products, avoid uh, any product which is having alcohol. Avoid medicated shampoos like ketoconazole or other things. Wash your face with the curd. Okay. Now we are coming to a homeopathic. So first of all, people are asking, can homeopathic dermatitis be cured? There are multiple videos which is showing with the time period that seborrheic dermatitis is easily cured. We received recently a video after 2 years of patient has permanently cured. He re-testimonial it, he was permanently cured. So I put I icon here and give you the video link. Can homeopathy cure seborrheic dermatitis? Yes, it surely cure it. Okay. In allopathy, there is only antifungal element which is working for few days and they stop working it because body has developed resistance or resistant immunity against it. Okay, so so these things are are easily controlled with homeopathy, because homeopathy resistance or the antibiotic resistance or antifungal medicine resistance not occur. Now, people ask the question, the root cause of seborrheic dermatitis. The cause are in the picture are the primary factor, malarial yeast, individual sensitivity. For example, four people living in the same house are not suffering, only one is suffering. Why? There is a their immunity low, there is a constitutional or the individual approach to find out the cause is required. Whether the person is having more stress in their life, some people are having hormonal issue. People with hormonal issue are having their breast like in male look like female due to the hormonal imbalance. We are having many patients which are having these. Individually, some patients are having IBS. IBS is also lead to these people are suffering from IBS or the gastrointestinal disease are also developing this type of disease. Okay, so the individual approach or the holistic approach cure most of the patient and turn the seborrheic skin into the normal skin. Homeopathy deal with the holistic system of medical science, help to maintain a normal health of an individual through the principles. The medical science not only relieves the symptom but cure it permanently, whether you are having gastric problem, immunological problem, or the other problems. We deal all those things together. Okay. So now the question is rise: what are the homeopathy medicine we can have? We can have in homeopathy which can treat this. I am explaining few medicines here. For example, graphite, thuja, phosphorus, kali sulf, natramure. These are the classical medicine used for the control of seborrheic dermatitis in homeopathy. But these are only idea. Okay. Never consider that these medicine can cure you. For curing seborrheic dermatitis, there is a deep understanding of the patient required that need a full case taking of the patient. So the for understanding deeply someone, we have to deeply understand the patient. Okay. So the homeopathy medicine first is written seborrheic dermatitis is a graphite. Graphite is for seborrheic dermatitis having people are having scales, are having severe itching or the dry skin. There is scales get decreased after washing, they get relieved, but next day it reoccurs. For those patients, graphite is a good medicine. There is a foul smell on the scalp. Sometimes people think this smell is like a cadaver or from a dead body. The scalp may stay soggy or washed. There is a gel type material coming. The hairs are tangling out. The hair are double edge on their tips. So aside scalp, it also lead to having seborrheic dermatitis in the eyelids and behind the ears also. Okay. Thuja is a classical medicine which is on a medical background. There are various studies published all over the world which show that it stop progression of the fungus. Okay, it is medically proved that it reduce the dihydrotestosterone, promote hair growth. Okay. It is having antifungal property, it is having hair growing properties which will help to grow hair. It is useful in those patients which have misused lots of medicine. The mm, the thuja is classically for patients which are heavy duty patient having obesity. They are classical. In the box, in Indian boxes, there is a mention people looking like a Ganesh, having the large tummy or having the gastrointestinal IBS symptoms are more thuja patient. They are having tendency to grow warts in the genital warts or the different type of warts. They are having prone to these conditions. So thuja are used by the people which are having psychosis, diathesis. They are having more conditions which are favorable to grow of seborrheic dermatitis. Now we are coming to phosphorus. Phosphorus is for those people which are thin, which are basically, it is a very fantastic medicine for seborrheic dermatitis. People grow very fast. They are first of all they are thin. Second, they are very tall. Their hair fall occur in the bundles. Not single hair are coming, there are bundle of hairs are coming when the hair fall occur. These lead to a bald spot which are clearly visible by the others. There is extreme burning on the scalp. Burning due to the erythema, people start scratching, and when they scratch, they they are having bunch of hair in their hand. Those people can use phosphorus, flakiness, and unnecessary hair fall are the classical symptom. Now we are discussing Kali Self. Kali Self is for those patients which are basically having a scales. Scales are more yellow scales. Yellow is yellowness of the scale is there. There is more infection. They are sticky in nature. They are soggy scalp. The scalp is soggy. Typically, we can say it. It is accompanied by itching on the head, tingling like a crawling or the like some insect is crawling on the head. These type of feeling are coming. People are having these are out of sense. Sometimes they are their brain is getting disturbed due to this. In a couple of cases, scalp itching, lead to bald spot. So, last medicine which we discussed are discussing is basically Natamur. Natamur is a classical remedy for a youngster who are doing too much masturbation. Masturbation lead to more sweating on the face, more sweating on the head. The more sweating occur on the face or head lead to seborrheic dermatitis because the more sweat lead to the growing of your hair, growing of the malaria in your head. So people doing over masturbation, they can use Natamur. Natamur treat patient having oily, sticky scalp, and the scalp is having burning, and burning is like a smoldering sand, like a warm sand thrown on your head. Scalp is having a headache sometimes. That is hammering type of headache. Like sometimes someone is beating your head with a hammer continuously. These people are too much irritated. They are having coryza. There is post-nasal discharges are coming. They are totally immunocompromised people. They are more having. So, so our topic is over here. What we discussed today, these are the herbal tips or idea that help people to recognize the potential of the homeopathy medicine. None of the homeopathy medicine should be used without the consent of the qualified physician. You can take medicine from professionally qualified physician after full case taking. Either you can take online treatment or offline treatment. You can visit some doctor, but doctors are mostly in India are using the old concept. They are not following diet. Diet is very important role. People are with seborrheic dermatitis. They need to control their diet. Diet should be more in the way that is containing less protein in your diet, more more green veggies in your diet. Protein exaggregated because protein produce extra heat. There is a caloric value is high. The more you eat protein, more hair fall will occur. People using protein in their gyms are suffering more from this, and people are using steroid. They are more suffering of this. Seborrheic dermatitis is not only a medicine. It is a lifestyle disorder which is an individualistic disorder affecting an individual rather than everyone is suffering. For example, if someone having two children, one children may be suffering of seborrheic dermatitis, while other children is having no symptom at all. Okay, so it is individualistic. It may not affect everyone in the same house. People are suffering from seborrheic dermatitis. There is a food tips for those patients that the patient should avoid protein, especially the non-veg are strictly avoided by them. Okay, because non-veg will lead to more of these problems. Second, they need to take more water daily basis. water consumption is 2 to 4 liter per day. Okay. They use biotin. Biotin is a vitamin or food rich in biotin, so that the skin get healed faster. Water consumption, increase your water consumption 2 to 4 liter per day. Avoid protein rich foods, take biotin, and eat fruit and vegetable. Take a sattvic diet or the simple diet as much as possible. Avoid high fatty food, hot and spicy food, alcohol, beverages. Okay. In milk and milk product, you can drink milk, but from a cow milk, not a buffalo milk, or the milk from the New Jersey cow. Okay, that is more infectious. Okay, the fermentative food you can avoid it. That also lead to or aggravate this condition. Okay, so our topic is almost over here. Okay, so if you like this, there is a like button. Please press the like button. If you want update on the seborrheic dermatitis, you can follow our channel. We are coming with these tips and tricks to deal seborrheic dermatitis in the future also. Okay, bye. Thanks a lot. Today topic is over now.